Just a few days later, Louise will be completely recovered. The process seemed painless, and we had a chance to talk with Louise right after the procedure.
The surgery was absolutely perfect. Everything went as expected. The lens went in beautifully, centered perfectly, and then I'm just going to make sure everything's fine, and then we'll send her home.
I feel great. He just put a numbing drop. Now it's fine.
For follow-up, Monday we're going to check her out and make sure that she's okay. At that point, we're checking the position of the lens. We're seeing what the vision is on that particular day. And with these particular lenses, the vision continues to improve over time. It's great that she had such a wonderful response at first for the lens, but it gets better. You think it's good now, it just keeps getting better actually over the next few weeks to months. So look out.
Right.
We're here with Dr. Sidney Tyson from sjeyeassociates in Vineland. Dr. Tyson, thank you for taking the time to sit with us.
Thank you for having me.
Can you tell us, how did Louise's surgery go?
I think it went great. The surgery went perfectly. There were no complications. I think everything went beautifully.
Explain, if you would, what you did.
Well, what we did for Louise was we removed her cataract. And as you know, the cataract's that cloudy lens of the eye that blurs vision. So we removed that cataract and we put in an implant. But we just didn't put in a traditional implant. We put in a special implant called a crystal lens.
Oh, why?
Why? Because we wanted to improve her vision in all ranges of vision for her. Traditional implants are only good for one distance, far away. These other lenses, the crystal lens, for example, has the ability to focus up close, intermediate, and far away all in one. It's like having a bifocal lens in the eye.
That's wonderful. What should Louise expect?
She should expect great vision. It starts out where her vision is quite good in the beginning and it continues to improve over time. And that should happen really soon, probably by the next day or two after surgery.
Do you mean that's her full recovery time?
No, it's not her full recovery time, but initially her vision will be very good. And the thing with these types of lenses is it does take a little time for the optimal vision to be achieved. So it does take a little bit of time, but in a few weeks her vision will be excellent, all distances.
Is the surgery painful?
Not in any way. That's a very common misconception that people have about cataract surgery. It's not painful at all because we actually use numbing drops. We don't use needles for anesthesia, just simple numbing drops for the eye. And people are very comfortable, and in addition to that, we actually give them a little bit of IV sedation if they request it.
Could you explain the benefits of this surgery for me?
Yeah, the benefits are that, first of all, cataract surgery is an attempt to improve a patient's vision from a blurred lens. The cataract is a blurring of the natural lens. So the first step to improve a patient's vision is to remove that lens. And once you remove that lens, we have to replace it with an artificial lens called an implant. So for Louise, not only did she have an implant, but she had a special implant, a premium implant, which allowed that focusing in all distances.
What has patients' reaction been like?
It's been phenomenal. The response to these new lenses has been phenomenal. People are very excited about it. They're happy with their vision. I'm happy for them because they're happy and satisfied patients.
Why did you choose to offer this kind of service here in Vineland? I mean, why not in like a big market like Philadelphia or New York?
Well, it's nice to be able to offer this kind of technology, this high technology, advanced technology in Vineland. Why not? Why do people have to drive all the way to Philadelphia to have this? We have the training here. I have the ability to do all the things that could be done in a major city right here in our hometown, Vineland.
Do you feel part of this community?
Oh, I love it here. The response from patients has been great. I love giving back to the community. I love helping people and getting them to see, wonderfully. It's been a great experience.
What does that mean to you personally?
It's just great to find that people have such a warm and friendly response to the things that we're trying to do here. And that's why our business has grown so much here. It's not just one type of lens or one type of procedure that we do. For example, with these multifocal lenses, it's not just crystallines. We have a number of different options for patients. So what we do when we evaluate patients for the first time is what we call a lifestyle assessment. We try and determine exactly what patients' needs and desires are, their hobbies, what their visual problems are, and then we fit the lens for their needs. So we choose with them the best lens for their needs.
Excellent. Thank you so much, Dr. Tyson, for being with
welcome.
us today. We'll be right back. If you have vision problems, questions, or are concerned about your visual health, be sure to call Dr. Tyson and his team at Eye Associates, 1-800-922-1766.
Is your life a bit out of focus? We can help. We're Eye Associates. Visit one of our 6 convenient offices and you'll see the difference. We diagnose and treat all types of visual problems in patients of all ages. Beyond primary care, Eye Associates offers leading-edge technology performed by Dr. Sidney Tyson and his team. We also offer the latest techniques in laser vision correction to correct nearsightedness, farsightedness, and astigmatism. Eye Associates' state-of-the-art laser vision center is located in Vineland, New Jersey. Call today and schedule your appointment at any one of our 6 locations. See better. Call Eye Associates.
We had a chance to meet up with Louise just a few weeks after her surgery. Let's check in and see how Dr. Tyson has changed her life.
The quality of the vision has made me very happy. My vision now is very clear. I can see distance, I can see up close. I notice a lot of things that I didn't notice before. Even though they were there, I didn't see them. After I had the surgery done, I was able to see things that I didn't know were there before. I could look at something and just look at it and say, well, it's nice or it isn't nice. But then I could look at the details in these things that I never saw before. I was very confident in listening to Dr. Tyson explain this to me, reading about it myself, and having it done. I had come to the doctor for Dr. Tyson a year ago, and I had said, I think I have cataracts, and he said to me, yes, you do have them, but they're not ready. I went back for my checkup within a year and a half later, and he said to me, oh, of course you're having so many problems. He said, because of your cataracts. So we talked about one lens, and he did a lot of testing. And then right before the surgery, he changed it to the crystal lens. You have to have faith in your doctor and try and read up on it as much as you can. I have a lot of faith in Dr. Tyson, and you need to. If you're having a surgeon, I don't care what kind of surgeon, you need to have faith in him.
Recently, Medicare and other insurance carriers have realized the visual benefit for patients desiring deluxe lenses. Therefore, they changed their policies to allow patients to upgrade to these deluxe lenses while continuing to honor their portion of the standard fees.
Thank you for watching Eye Associates Focus on Healthy Vision. We hope you found the program to be educational and informative. We also hope that it's helped to ease some of your fears and clarify misconceptions about cataracts and cataract surgery. So give us a call if you have any other questions about these recent advances. We look forward to hearing from you.
You've had the opportunity firsthand to see how Dr. Tyson and his staff have, quite simply, helped people to see better. If you have cataracts or other vision problems, contact Dr. Tyson and his staff. Remember, you can visit them online at their comprehensive website, where you can find out more about their facility, staff, and you can hear even more success stories from actual patients. Log on to www.sjeyeassociates.com. That's www.sjeyeassociates.com. To make an appointment, call 1-800-922-1766. That's 1-800-922-1766. And take the first step to changing your life. Thanks for watching Eye Associates Focus on Healthy Vision. We'll see you soon.
To find out how Dr. Tyson and his team at Eye Associates can help you to see better, visit one of our 6 convenient locations today in Vineland, Cherry Hill, Blackwood, Hamilton, Mays Landing, and Stratford, or call 800-922-1766. That's 800-922-1766, or visit us online at sjeyeassociates.com.
I've worn glasses and I lose every pair, and if I don't lose them, I break them. Your eyesight changes, you have cataracts, and you kind of do what's best for you at that particular time. My vision now is very clear. I was able to see things that I didn't know were there before. I am very glad that I had this done. I would say that the surgery is life-changing.
Call Dr. Tyson and his team at Eye Associates today for your appointment.